Ladies and gentlemen, welcome back to Blooming Day. Thank you for joining us. We are in for a treat. The fireside chat, please welcome Dr. Chelsea Clinton and Dr. Ashwin Vasan.
Hi everyone. Sorry that we were chatting and so we almost missed our welcome onto the stage. It's awkwardly scurrying up here. I'm so grateful to once again be with Blooming Health. I just truly admire Nima and the team so deeply and so strongly believe in kind of the what and the why and the how of Blooming. And so thankful to my friend Ashwin for being with us today, sharing his experience as our health commissioner here in New York City, but also his experience before his tenure here in New York and what he's been up to since. So really, Joshua, thank you so much. I know this conversation specifically is really oriented on innovation and the future. And one of the things that you and I have talked about over many conversations now is what really kind of innovation should look like and who gets to be part of the future. And so maybe you can reflect on that opening premise and just share some first thoughts.
I think it's a great way to start. Thank you for having me. Thank you to Nima and the team. It's my first time here, but as I've learned more about what Blooming does, I think it's actually a great answer to your question. So much of what plagues the patients that I've cared for 20 years, whether abroad or here, the communities that I work with, running a nonprofit or as health commissioner, are the complexities of social needs that kind of compound to create the conditions that make it harder to be healthy, regardless of the kind of healthcare you receive. And so, not only is it admirable, it's absolutely vital that we have organizations like Blooming Health attacking those social needs, health-related social needs, and bringing the best of innovation and technology to bear on social care. But I think implied in that is, who is it that is living with, suffering from, at disproportional risk of bad outcomes from compounding social needs? And it often correlates with things like poverty, things like race, things like gender, and historical inequities that have left access to care and therefore health outcomes so disparate in this city, in this country, and in this world. And so if you layer technology right on top of that, you will simply compound those inequities because you haven't answered that core question, which is, what is it about the conditions around us that we want to change? And so I think it's really important for anyone interested in bringing innovation and technology to bear on questions of equity, of closing gaps in access, reducing costs, improving quality, to say, what is it at a human level and at a social level and at a policy level that's actually driving these disparate outcomes? And then what is it that technology can do fundamentally better? And I know that in my career, I have tried, whether it's in building technology for mental health, bringing technology to the health department to try to get us better insights in how to predict disease and therefore resource communities. A lot of it has been around, what is it that fundamentally we haven't done yet? And is there a way in which technology helps us do that easier, better, faster, more consistently, more reliably? It doesn't change the question, the fundamental question of, are we willing to respond to what the data tells us? And are we willing to respond to what information we learn with good technology? So that's, I think, my general orientation to these questions of what does the future hold, and who gets to share and who gets to benefit from the, this major technological transformation we're all surrounded with. I think it starts in part by having the right voices around the table. Are we asking the right questions? And are we meaningfully getting to the pain points that people face in their everyday lives? And so that's what I'd like to see much we should all care about. We see disproportionately unequal outcomes consistently across this country in rural areas. And yet that has to be seen in light of some of the structural gaps that are being created by fundamental changes to things like the Medicaid program. And does something like the Rural Health Transformation Grant program end up just being a substitute or a band-aid for another problem created somewhere else? So these are the kinds of questions that I think need to be at the root and consistently centered in any conversation around what AI can do, what technology can do, what innovation can do to change population health in this country. That was a long answer, sorry.
No, thank you, Ashwin. No, a helpful framing. Since you just you did bring up AI and also on the heels of talking about the Rural Health Transformation Plan and how it might be incongruous with some of the other policy choices that the current administration, current Congress have effectively made through the budget processes. I am curious though if we kind of take a step out of this current moment for a moment, what do you think kind of is the role of government, and what do you think is the kind of opportunity and responsibility of the private sector, and also kind of where do you think kind of the NGO sector also kind of fits in with this, because you've kind of worked and led now each of those. And I'm asking this question partly against the backdrop of the study that came out now a couple months ago from researchers at Mount Sinai that ran multiple different scenarios through ChatGPT, and patients were under triaged 51.4% of the time. And I would hope that if we had a different Health and Human Services Secretary, that then would have catalyzed that person standing at the lectern and saying, like, we are all really excited about the potential of AI. Like, arguably, like, AI has been in healthcare longer than any other industry. Like, we've had predictive analytics and hematology for decades. But clearly we're at a different kind of juncture now where we need real consideration of effectively the large-scale experiments that we are conducting on the American public, often without their understanding or arguably even their consent. And while these tools have huge potential, there's a lot of work that still needs to be done. Here's how the government is going to react in A, B, C through Z. And then the private sector will be like, actually, like, we're going to push back on that because that's our role, but we recognize like there is a role for appropriate regulation, appropriate oversight, appropriate kind of continual conversation, which is, shall we say, how the FDA operates. So what do you think kind of in Ashwin's ideal world, recognizing all of the huge promise, but also the real concerns, and I think importantly, the unknowns, do you think is kind of the role of government, kind of the federal, state, or local level, the opportunity for the private sector, and where do NGOs fit into all of this?
There's a nonprofit called the Fund for Public Health in New York City. It's affiliated with the New York City Health Department, and it helps us do a lot of catalytic things. For 20 plus years, it's been kind of a nonprofit adjunct and funder, but it has a great tagline. Why am I leading with this? Because it has a great tagline, and it says, health is everybody's business. And I think that that's a great way to frame health as existential, but also truly impacted by every sector of society. And so that's the kind of ethos I've both learned from and tried to implement across the board in each of the positions you alluded to. And yet, that has to be done with some semblance of some GPS coordinates or a flying formation or whatever analogy you want to use to say that you're pointed in some singular direction that benefits us all, and particularly benefits the most vulnerable. And that is a unique role of government. Government can very much point the way in saying and prioritizing what are the biggest problems we need to solve and why. Not necessarily all the aspects of how, but these are the health challenges that we face as a nation that are mission critical. Whether it's rising rates of premature cancer, which we've talked about, whether it's increasing and persistent and sometimes just really stubborn disparities in Black maternal health. In this city, we tried to do this here in New York City with Healthy NYC. We said, what would be a harbinger or what would be a metric that we could organize around that would say we're doing better than we were last year or the year before? And that was life expectancy. We didn't think that that was the perfect measure of health, but it did try to tell us, as we often say in public health, our biggest success has been the fact that, 100 years ago people were living into their 40s and now they're living into their 70s and 80s, and a lot of that can be attributed to public health. So if that is true, then cannot lifespan and health span be an organizing mission for any civic enterprise and government in particular? So we tried to organize around that. We passed that into law, but we were very clear from the beginning it's going to take all of us. So we set up a private sector consortium, a nonprofit consortium, a philanthropic consortium. We even got Carnegie Hall to say, what can we do to help? Whether it was bringing the arts and culture to children and to work on mental health issues and to use their platform to raise up health. Some of it you can trace to outcomes, some of it you can just simply say is about movement building. But make no mistake, health is everybody's business. And so if you accept that to be true, then government should be in the business of laying out the agenda and saying, this is where we as a nation need to go in order for us to live healthier, longer, more fulfilling lives. Now, technology is moving fast, AI is moving fast, and right now there doesn't seem to be any semblance of what one might call an industrial policy around that. There doesn't seem to be any direction for how we shape technology towards solving the biggest public problems. And so we're left with a conversation that's fairly binary. Either you're a regulationist or a deregulationist. Either you want to put your foot on the accelerator or take it off and put it on the brake. But no one's having a conversation, not in Congress yet, not in the public domain, of like, how do we steer this technology, which is here to stay? How do we steer these technological advances towards solving some of the biggest public problems of our lifetime? And it's very reasonable to say, well, we don't think they can be. There are some problems that are fundamentally human, that are fundamentally economic, that are fundamentally cultural and sociological, and that are not amenable to technology too. But in order to map that, you need to ask the question systematically. And that is true for any sector, but health in particular. We have a health system where we spend more than any other country on earth, both writ large and per capita. We get fairly middling health outcomes for that, and we have fairly disparate health outcomes and inequitable health outcomes buried within that. There is a fundamental question of what is our business model of health? And then the next question is, can technology be used to solve some of those issues around the business model? There was a recent report that just came out of the Peterson Health Care Center, the Peterson Health Technology Institute, that just reinforced something that I think you probably all know. Health tech right now, AI in health right now, is not deflationary. It's not reducing costs. If anything, it's increasing costs. Why? Not because the technology is good or bad. It's because our application of it is still fundamentally within a system that is incentivizing rent extraction. It's incentivizing people making money off our healthcare system. And if that's your central organizing premise, then it's going to be very hard. If that's your only central organizing premise, it's going to be very hard to solve those big mission critical problems. So what am I getting at? We are crying out for a moment where leaders in health or in any field need to set out the agenda, need to stop only having a conversation around whether AI is good or bad, or safe or not safe, or risky or not risky, but rather, what are the aspects of this technology that can be used to solve some of the most stubborn problems in all of our core systems, whether it's healthcare, education, and so forth. And if they cannot, then to be upfront about that. That's what this moment's crying out. I have not seen that conversation. I'm hoping it will come from the people in this room and others. But I think that's my view of the role of government. To lay out those GPS coordinates and then everyone runs towards that direction.
I believe in speed limits. I think that's my response. And all that speed limits actually have enabled, facilitated, and protected.
And sometimes the speed limits are buried within
an optimistic one
And optimistic.
that is oriented around the questions that I find deep resonance with, whether we're talking about maternal health or we're talking about early onset of cancer, and do believe that people like those, and including those in this room, can really help us coalesce at least toward a draft agenda, with hopefully a real sense of enormous urgency, coupled with candidly a sense of real responsibility. I want to know, you mentioned trust earlier, and you mentioned trust in a myriad of ways, in the negative, whether falling vaccine rates or where we've had these intractable challenges that correlate to people saying effectively, well, why would I trust the health system? I also think trust relates to time and attention. And I was thinking while you were talking about one of your predecessors, someone I also deeply admire and I'm lucky to call a friend, Dr. Tom Frieden, who, just to segue from the AI conversation, says publicly and frequently he thinks it's malpractice if doctors are using open evidence, but also thinks it would be malpractice if open evidence were used in the absence of a doctor or a nurse who could put kind of real hands and eyes on a patient. And yet he spends most of his time trying to help more people in more places here in the United States and around the world understand blood pressure. And so I bring that into this conversation because we're spending a lot of time, understandably, talking about the hantavirus right now. And yet, I don't think we've spent any time recently in any of the large kind of media outlets talking about blood pressure. And so I wonder, what reflections you have for the people in this room, but in the broader context of Blooming Day, about how to try to orient attention on what really can matter for someone's health, longevity, hopefully healthy longevity, and how that orientation and that focus and hopefully that kind of accompaniment also leads to trust.
I think we're at a moment where people are desperate to seek answers from wherever they can find it, and now they have more options for where to go. Take the issue of mental health, which I'm sure we can talk about later, but just as an example around access, 1 out of 3 Americans live in a mental health professional shortage area, which means they cannot adequately get access for a variety of reasons, whether it's geography or cost or coverage. To me, that is fundamentally a breakdown in trust. Why would anyone seeking care trust a system that's not able to respond when they seek it? And so it's not surprising to me then when I see some estimates of around 4 out of every 10 users of ChatGPT is asking questions around mental health. Because where do you go? And so one answer to the question of trust is responsiveness and being there. Not necessarily with all the answers, but just simply time and presence and attention, as you rightfully said. We should continually strive to build a system that is present in people's lives. And what's interesting about the moment we're in is that presence, medicine's fundamentally a human endeavor. It's about one human being accompanying and shepherding and ministering and frankly being present through someone's illness journey. At the most fragile moment, most vulnerable moment, you all know that, those of you working in and around the space of blooming health and healthcare just in general, the most profound moments in this field are when you can connect with someone about the human experience of illness and maybe slightly redirect that trajectory towards the good. And even if you cannot, to improve that time that they've had through that journey. I believe that trust has to start with that kind of human connection, and that anything that gets in the way of that is somehow pulling us away from this core social responsibility that we have to one another. Now, in its current form, we don't have a world in which we can deliver all the doctors, all the care, all the attention and time and responsiveness in the ways that we would like. And so I guess it's malpractice, as Tom said, and I agree, to not at least take to its logical conclusion how far we can go to leverage the good parts of technology while keeping people safe in the process. I think that safety point is one that often gets lost. It either gets lost completely or it leads. But I think it has to be sort of just embedded in any conversation around technology in healthcare. So I think this trust has to, especially in an era of innovation, this trust has to be about being there. When the immediacy of concern, the immediacy of response, when you have a health question and you or one of your patients has a need, is so powerful. I felt that too as a father, wanting to get an answer for when my child is sick. And I'm not a pediatrician, so there are many things I don't know. There's many things I don't know about a lot of things, but let's start there. And, you know, that immediacy, that ability to go on open evidence, that ability to mine the data and say, like, where can I do a first pass of information so that I can start to make sense of what's going on? I'm getting a lot of incoming now about hantavirus, as you might expect. Hantavirus, I know about it. I learned about it in infectious diseases, but it's not something I think about every day. It's not something I've thought about, perhaps ever, in my career, other than learning about it from a textbook. And now I'm using these tools and these technologies to get smart, quick, and use my experience and my skills to then say, how can I synthesize that to reassure people, to communicate clearly to people, and to offer them the data and the evidence and the guidance so that they can make decisions for their everyday lives, something I did all the time during COVID. The way that I think about these tools is exactly as you said, not as a replacement, but as a learned intermediary. Something where you say, I'm not talking to this tool or this technology as a doctor, I'm talking to it as a really smart person that I might know and that will help me guide my questions when I actually talk to someone, a human being. And so I think that's what Tom's getting at. It would be malpractice for me as a physician not to use these tools. And I think it's totally expected that the general public will use these tools. And the question is, when do we all meet around a set of conversations where we can make decisions? I wouldn't use these tools to make decisions, I would use these tools to learn. To learn about yourself, to learn about what's going on, and to learn about what I can do to ask better questions and give better answers. How does that reveal what's hidden? That's a really good question, and I think Tom is a great example of someone who sees the invisible and tries to make it visible through data, through advocacy, through persistent, stubborn effort. Hypertension might be the hardest problem to solve one of the hardest problems to solve in medicine because of its invisibility and because of its indolent course, the slow growing nature, the slow developing nature of it. It makes it so tough. I think there are many things we can do to get the everyday person more engaged in thinking about blood pressure. There's a lot of work being done, for instance, on wearable technologies that are better. There's a lot of things being done in the AI space about sort of routine surveys and questions, things that don't involve going once a month to a doctor and just getting your blood pressure checked and using that. I think for anyone doing this work, whether you're doing work in Medicaid or social care or global health, these are the kinds of solutions where I think technology could solve something that's fundamentally hard for us as humans to do, which is to pay attention to things that haven't happened yet, to pay attention and to keep that attention for a long time. Hypertension, the object lesson there, object example there, and to then know when to act and what to do.
I mean, I mentioned hypertension because I thought it would illuminate the things that also hopefully are not as particularly challenging. I think something else first part of your reflection, when you started with the healthcare deserts and mental health, very much can be either replicated or kind of compacted by overlapping healthcare deserts in other areas. I think about this a lot in maternal health. My original home state of Arkansas, more than 1/3 of women of reproductive age live more than 2 hours away from a women's healthcare center. That is a kind of pre-existing impediment to trust. And, oh, by the way, in Arkansas, it's also a state now where you're unable to access a full complement of reproductive health care, were you to need certain interventional services or to have chosen that was the right answer for yourself and your family. So that too, I think, further exacerbates, understandably, trust. And yet I think so much of what you also said, at least hopefully whispers, if not fully articulates, the ways in which we ameliorate those challenges and instill and hopefully buttress trust. One of the things that I realize we're tipping down in time that you and I have talked about is the importance of public service. And there are a lot of people in this room who clearly are, by definition of being in this room, interested in social care, interested in public-private partnerships, interested in kind of civic and social well-being, however you might define what brought you here, either as a kind of professional or personal passion. And I wonder kind of what, maybe pitch is too pointed of a term, but kind of what you would want to say to anyone here who might be thinking about joining a local health department or joining a state health department, who might want to be part of trying to deliver services, engender, and buttress health kind of from the public posture.
I would say, quite simply, there's never been a more important time to lean into public service. It's exactly when things feel most volatile and most uncertain, and when you yourself, just as we all are, struggling to make sense of what's going on around us, whether it's in health or beyond, that you need to lean in and be that voice and be that sort of stable, responsible steward of the public trust. And what I mean by that is that in the absence of that kind of leadership is when you see that vacuum filled by all sorts of information, disinformation, maybe less than publicly minded incentives. But I know that everyone here is focused on not only just delivering care, but delivering care to the people who need it the most. And it's exactly this moment when it is needed to lean into public systems, because there is no, we all had a mentor, a guy called Paul Farmer, who was just a giant in the field of global health, and he used to say to us, there is no other entity that can protect social and economic rights other than government. There is no entity, no sector of life that's solely dedicated to protecting everybody. And it's this moment when the communities you serve, the patients you serve, and the general public need protection. They need care and protection and stewardship and sense-making at a time when it feels like a lot of things don't make sense. So I would encourage, public service is the greatest privilege of my lifetime. It's something that I will continue to strive to do. Anyone thinking about it, certainly, come talk to me, come talk to us. But also, there are also many ways to do it. It doesn't have to be joining a public health department necessarily. It doesn't have to be working at a public safety net hospital system, although those are both vital and admirable. But as you're hearing us talk, and as you're hearing throughout the day at these sessions, is that there's a vital set of partnerships out there between the public and private sector, between community-based organizations and the public sector. But at the hub is the protection, the responsibility, and the stewardship that comes with government being a part of those conversations that really amplifies your work and makes sure that you're there representing the interests of those who need it most, giving voice to the voiceless, and ensuring that we're solving the hardest problems that we face in health and beyond.
And that we're focused on solving those hard problems over time, and not only in time. Ashwin, thank you so much. I'm really just always grateful to be in conversation
Thank
and
you.
community with you. And
Great
thank you to
questions.
everyone here at Blooming. Thank you.
Thank you so much.